Good afternoon. Good afternoon and welcome back to Hunter College from wherever you may be linking in. I'm Jennifer Rabb and have the tremendous privilege of serving as president of the wonderful Hunter College, whether I'm doing so in person on our campus on 68th Street or in deference to the new normal here on Zoom. Let me start by sending my best wishes to all of you and to all of your loved ones during these challenging times. I hope that you are staying safe and well. I know we will be seeing each other soon on the other side of this crisis when the world returns to where it was only a few short weeks ago. Before I introduce the speakers for this afternoon's event, the second in our continuing Hunter at Home series, I want to take a moment to thank those of you in our vast network of donors and supporters who have contributed to assisting our students during this terrible crisis. Your contributions have provided our students with food and rent money, as well as the technology they need to access their online courses. Your outpouring of love, support, and generosity has made a vital difference. Our Hunter family has truly taken our motto, Mihi Cura Futuri, the care of the future is mine, to heart. Our online public program series, Hunter at Home, is an exciting live stream series presenting lectures, readings, and discussions. This series has a dual purpose: to inform our community and to keep us all thinking about the issues involved in both the pandemic and to provide our intellectual stimulation. Alongside of two up-to-the-minute discussions on coping with the current crisis, our series will include poetry readings, history lectures, and even discussions about animal behavior, to name just a few. In the days to come, we will debut talks about both dolphins and the beetles, not the insects, but John, Paul, George, and Ringo. Our series will also debut a reading by New York Times bestseller Taya Obrecht, take a deep dive into Van Gogh's creative process with art historian extraordinaire Michael Lobel, and present a timely primer on how to protect your incoming groceries with the director of Hunter's Food Policy Center, Charles Platkin. We are honored to feature so many extraordinary scholars from our faculty to share their vast knowledge and research. Today's panel will be followed by a lively Q&A, and we hope some very strong participation from you, our audience. If you have a brief question for our panel, type it into the chat function anytime during the program so it can be directed to our host. You can also rewatch this and all the talks in this series on a new site we are calling Hunter on Demand. Our program this afternoon is co-sponsored by our wonderful Roosevelt House Public Policy Institute, which has been broadcasting these series of programs at home during this difficult time. Special thanks to Harold Holzer, our Jonathan Fenton Director of Roosevelt House, who is doing a terrific job during this crisis, as well as throughout the year. Roosevelt House has co-sponsored this afternoon's program, the topic of which is Lessons on Pandemic and Age. And this topic, of course, couldn't be more current. We have a dream team on hand to tackle this complex issue. First, we have our own Dr. Ruth Finkelstein, Professor of Urban Public Health and the Rose Dobrof Director of our Brookdale Center on Healthy Aging. Before coming to Brookdale and Hunter, Ruth was the architect for the age-friendly New York City initiative. She has spent her career helping to make this city a great place to grow old in, and we are so happy to have her here with us today and at Hunter College to address this relevant and relatable issue. Thank you, Ruth, for your leadership at this extraordinary time. Christian Gonzalez Rivera is the Director of Strategic Policy Initiatives at the Brookdale Center, where he turns raw data into real-life practices. At the center, he orchestrates strategic partnerships and formulates and prioritizes key policy initiatives. He is a Sterling Network Fellow and President of the New York State Society on Aging. In 2016, City and State named him one of New York City's 40 under 40 rising stars. And Christian, you are certainly one of Hunter's rising stars as well. Thank you for joining us today. Dr. Lilliam Barrios-Paoli has served 3 New York City mayors as Commissioner of Aging and HRA Administrator. She became Deputy Mayor for Health and Human Services under Mayor de Blasio, and also served as Chairwoman of the city's Health and Hospital Corporation. We like to tease her that she is a recovering city official who is now a senior advisor at Hunter College and a valued member of our community. Our thanks go out to Ruth, Christian, and Lilliam for speaking with us today and for all you do for Hunter and for the community of seniors here in New York. We look forward to hearing from all of you. Please take it away, Ruth, Christian, and Lilliam.
Okay, thank you very much, President Rob, for that introduction, and thank you to all of you. I mean, it's like, although I can't see you, I can feel that there's a lot of you out there. So thank you very, very much for joining us. So I should start by saying, I mean, it's like that, you know, this pandemic, this COVID-19 pandemic has really profoundly affected us all, you know, with the recorded number of COVID cases in New York City surpassing 100,000, a growing number of us, unfortunately, have people who are close to us who have become ill. But for those of us who are lucky enough to be safe at home, the governor's executive order to close all essential businesses, you know, has meant that our experience of the city has largely been reduced to our homes and our immediate neighborhoods. But at the same time, as a lot of us are sort of establishing parallel lives at home, you know, replacing the theaters and shops and restaurants and nightclubs that filled our New York days and nights with whatever experiences we can create at home. But not all New Yorkers are experiencing the pandemic in quite the same way. For instance, more than 1 million people in this city are essential workers. So that's about 1 in 8 New Yorkers. And these people are still commuting to their jobs as medical professionals, as grocery store clerks, delivery people, public transit operators, truck drivers, and many, many more. But the differences don't stop there at how individuals experience this crisis. Whole communities of people and identity groups of people in this city are experiencing the crisis very differently. For instance, essential workers that can't practice social distancing at home because they're going to work are much more likely to be people of color, to be immigrants, to be lower income people. And also, while all of us experience some level of anxiety around the crisis, I mean, I know I do as well, older adults, especially those with existing chronic medical conditions, have additional need to worry because they're a prime risk group for getting sicker and requiring hospitalization if they do get infected. So what all this means is that the profound implications for public policy of the very different ways that various groups of people experience and cope with this crisis are at the heart of today's conversation. I mean, so that's at the heart of what we'll be talking about here. So yes, I mean, we're very lucky to have Ruth and Lilliam from Hunter who can really, really speak to that deep issue. So unless you wanted to start with anything, Ruth or Lilliam, I thought we'd just start asking you some questions.
Okay.
All right. So I'll start by saying, I mean, we've been having a lot of discussions about this at Brookdale. I mean, it's like about, again, I mean, it's like how the COVID-19 pandemic has affected people very differently, you know, depending across racial, ethnic, socioeconomic, and age lines. So why are these differences important? Why are these differences in experience important?
Well, first of all, let's speak for just a minute to summarize what the very important differences are. So first, we have very important differences by class. You've alluded to this in your introduction, but occupations have very different risk profiles in the current moment. And as is now very clear, the ability to work from home is itself a privilege that is not distributed evenly in the population. And in fact, we know a little bit more about how it's distributed. Only about 1/6 of people who are Latinx are able to work from home, but more than 1/3 of people who are white can. Another class-related difference, particularly in a city like New York, is space. And we're going to be talking about the continuum of having a lot of space to having no control at all over your space and living in congregate settings with others very close to you. But an important difference is how many people are living in your dwelling unit with you, in how many rooms. I want to be clear, this is not about density. Density is how many dwellings are there on your block, and that is not itself a risk. What's a risk is how many people are together in your room with you. We'll talk a little later about more detailed analysis showing the way that designations of race and ethnicity track back to class and to hospitalizations and deaths so closely. And age, I wanna, Christian, can you show those health department slides that I'm obsessed with all the time? I wanna make the point right from the get-go about the distinction about age. We've talked in a sort of big way in the media and in general conversation, the other one, and in general conversation about how age is a risk. Age is a risk. Yeah, that the age, right. Okay, so look right here, and this is COVID infections, which is a very iffy construct given the issues about testing, but just work with me for a minute. COVID infections by age. And what you notice when you look at this is that COVID infections by age are reasonably similar from one age group to the next. Now go please to hospitalizations. But in sharp contrast, hospitalizations dramatically increase with age, and deaths increase even more dramatically. So what we see is that age is a factor that is associated with severity of disease. We believe that association is in turn associated with multiple chronic conditions and decreased immune effectiveness. But I want to be very clear that there's a distinction between risk of infection with the virus and risk of severe disease with the virus. Why does this make a difference? It makes a difference because the policy interventions that we need to be thinking about are very different based on whether we're talking about exposures, we're talking about significant illness to death. Do you want to take it from there, Lilliam, for a minute?
Sure. I think it's fair to say that while we're all, that we're not all on the same boat. We may be all in the same storm or in the same ocean, but certainly we are all in very different boats. And I think here is where we see what has happened when you have real disparities in the city. And with the age, it's not any different. Poverty, a lifetime of lack of good medical care, diseases that you developed fairly young, all of these things are coming to roost. And essentially, that is why we're seeing a disproportionate number of minorities that are getting ill and minorities who are older that are getting ill. And part of it is that they have a disproportionate, they've had a life that has had a disproportionate share of poverty, access to good health care, good nutrition, and things like that.
Okay. And so along these lines as well, I mean, it's again, this is, I mean, Ruth, in particular, you talked about how so many of the divisions that are important here are along the lines of class, along the lines of age, for important reasons. And Lilliam, I mean, you talked about how in many cases, I mean, these are existing inequalities that are only now sort of deepening. I mean, it's like the cracks in our social fabric, I mean, it's like are really sort of shining in a very bright way, because of this pandemic. So can you talk a little bit more about, I mean, it's like, how are these inequalities deepened by the crisis in particular? I mean, it's like, what are we really seeing now that's instructive?
I think it's a little bit of what Ruth was saying in terms of space. We know that housing is a big, huge issue in New York, and we know that many families live in overcrowded situations. And certainly the ability to self-isolate, which is the one weapon we seem to have with the virus, it's almost, people are unable to do that if they're sharing a one-bedroom apartment with 5 or 6 other people. So space is really important, and the quality of the housing is really important. If you're living in public housing, if you're living in a tenement, if you live in a dilapidated situation, that is forgetting about a stressor, that is also something that leads you to be much more vulnerable to disease. The ability not to have appropriate nutrition throughout your life. The ability to have appropriate medical care. So all of these things are there, have been there, but I think have been tremendously highlighted when you see how the disease has been distributed and who is getting hit.
Oh, sorry. I mean, one of the things that I can't help but think about is that both of you, I mean, it's like Ruth and Lilliam, I mean, it's like you were in sort of important positions in the city. I mean, it's like during one of our last crises, which was Sandy, where also, I mean, it's like just like this crisis, I mean, it's like it really highlighted a lot of inequalities. A lot of them were along the lines of age and race and class. I mean, a lot of the things that are happening now, this crisis is very different for important ways. But again, I mean, it's like there seems to be something about, I mean, it's like these deep crises really highlighting these inequalities. What are some lessons that we learned back then? I mean, it's like that are reverberating today.
So, what I remember of Sandy is that most importantly is that Sandy was a circumscribed event.
Mm-hmm.
It happened and it went away, and then it left us with the aftermath, but the aftermath was experienced very unequally. If you lived above 14th Street in Manhattan, you didn't know anything happened, essentially. If you didn't live in the Rockaways or in Staten Island or in, parts of Queens and Brooklyn, Red Hook, you really, it was over and done. So it really, it was something that was circumscribed and a lot of people could come and help. This is so different in that, we're all experiencing it all the time. You can't just walk out of your apartment and help the most needed without taking immense risk. So it's a very different thing. The same thing with 9/11. I was very much involved with the 9/11 fund. It was a horrendous thing, but it happened. And then, you had to deal with the aftermath. You had to deal with all the consequences. But again, it was a one-time event. This is an ongoing thing. I mean, I think that that's what's so debilitating to everybody is that this thing just never ends. It keeps going. And we all feel very vulnerable. We know there's not a cure. We know that, there's no vaccine. So I think that the emotional component is also very, very frightening. Granted that with 9/11, you also felt extremely vulnerable because of the terrorism part. But somehow this has a very different feel to it.
Mm-hmm. Mm-hmm. So I wanted to, that's a great point. I mean, it's like another one of these sort of points of inequality that really has to do directly with age is really around social isolation. I mean, it's like in Sandy, as with today, social isolation, I mean, it's like really ended up being one of the big factors that sort of makes the crisis worse for especially a lot of older adults. And Ruth, you and I actually published an op-ed in City Limits. I mean, now it's a month ago, though it feels like a lifetime ago, that made the point that is now sort of common knowledge, that social distancing is likely to make social isolation worse among older adults.
Right.
One of the points that we made in that op-ed is that, we sort of talked about this widely cited study that showed that the effects of prolonged loneliness and isolation on physical health are roughly equivalent to smoking 15 cigarettes a day. I mean, certainly that's a study that's been cited a lot among sort of folks who work with older adults and an older adults policy. But I'd like to hear from you. I mean, it's like what sort of social and policy structures lead to social isolation in older adults? And of course, I mean, it's like, how does today's social distancing make the social isolation pandemic worse?
Right. Well, so we've got this kind of irony that we have sort of killers at both ends of the curve. You've got killers from being too alone, and killers from being two together. In the case of social isolation, my students have been making so vividly clear to me. I miss them, so I teach them in Roosevelt House and now online, but they've been making so clear to me that social isolation is not just a phenomena affecting older adults. It's a phenomena affecting across the age spectrum. It's just that the various strategies and tools to deal with social isolation are different across the life course. So, you know, in New York is a city where a lot of people live alone across the life course. It's one of the characteristics of the city, but 30% of people over 65 live alone. You know, it's even higher, close to 50% of people over 85. And surveys have shown now, surveys since COVID, that indeed the people who are feeling the most socially isolated are older adults. But interestingly, very interestingly, I think, the people who are the most anxious, depressed, and hopeless from being socially isolated are the younger people, 18 to 29. And in fact, older adults are roughly twice as likely to be less bothered, or half as likely to be bothered, as they say in English, by this social isolation, which I believe is a reflection of also the resiliency and the, you know, range of variation across older adults. One of the things that seems very dangerous to me is that in our interest in protecting and preserving the health of everyone in New York, we paint with too broad a brush the sort of frailty and vulnerability of older adults. We need to make distinctions. It is absolutely the case that those people who are living in the long-term care facilities across this city, this state, and this country could not be at graver risk, as is true for those people who are in jails, for those people who are in homeless shelters, and for those people with high physical risk, low social control across the country, huge level of risk. But I read a statistic about food distribution differently than other people do. So the city has actually done an amazing job in protecting the food supply chain and even getting food to those people who are home and isolated and vulnerable, while certainly imperfect, and there are certainly people not known to the system. But the food pantries and the food banks are understaffed by 40% now. Who are those 40%? Those 40% are older adults who now can't go to their jobs at the pantry, now can't go to their volunteer shifts in the food bank. And it shows the significant contribution that older adults are routinely making to the health and the life of the city. And our challenge now is to turn that contribution in the direction of the most vulnerable members of society. And there are numbers of good examples of places that are doing that in our social service organizations, in the mutual aid societies, in neighbor to neighbor social support. I've now talked too long, but I do want to make clear that while older adults are at enormous risk due to social isolation and also due to unsafe congregate living, we're also part of the resource base that's going to help New York into the phase of recovery and response when we get there.
Okay, I mean, it's like, so, I mean, it's like what I hear you saying really, Ruth, is that you have older adults, I mean, it's like who have been contributing greatly. I mean, it's like to the very support systems that are helping the city. I mean, it's like food banks are certainly an example. And you have people, I mean, it's like who are at greater risk. I mean, it's like who are still trying to go to work and I mean, it's like and to take care of their needs, but they're at greater physical risk because of this. So it implies, I mean, it's like really that there's both a biological sort of component to, you know, this pandemic, but also a sociological one. I mean, it's like, and those things are very much intertwined. Can you help us? I mean, it's like really think about how those two, I mean, you started to do this. I mean, it's like, but how those two things sort of combine. I mean, it's like, what are the structures that make it difficult for people who are at risk to be able to contribute? And also, I mean, it's like put certain people in harm's way that, that wouldn't otherwise be the case.
Well, we need first to call out essential workers, and we need to call out essential workers. You know, I mean, this is not a novel observation. It's been made now repeatedly, but the sort of unsung heroes of essential workers include the direct care workforce, all those people riding on the buses and riding on the subways to go take care of the most vulnerable New Yorkers, go into their homes and continue to prepare food and give medication to and clean and care for people. And that is an intersection between the I mean, that is sort of the ultimate intersection between the biological and the sociological. The other occupations, the people that we take completely for granted, that, you know, my sitting here in, you know, splendor in my bedroom is dependent upon the fact that there are still grocery store workers stocking the shelves, pharmacists filling my medications, delivery people coming, people still caring for one another's pets, as well, obviously, as the healthcare workers that are so centrally on everyone's mind and who account for, be clear about this, a fifth of the coronavirus deaths so far in this country are healthcare workers. Another fifth of the deaths so far in this country are people in long-term care facilities. So we have very significant clusters based on circumstances and occupation that we're taking for granted.
Yeah, and that's a very important point to make. And I mean, along the same lines as that sort of intersection of biology and sociology. I mean, one of the devastating things that has really sort of come to light through this crisis is really the frailty of our social infrastructure. And I mean, now I'm talking not just about specific occupations, but the fact that, you know, there's not one safety net for all Americans, nor even for all New Yorkers. I mean, but rather everyone is sort of fending for themselves through the sort of financial, social, and knowledge resources that they've been able to amass. And I mean, as you said, Ruth, I mean, it's like those that have more social controls, I mean, have more ability to insulate themselves are the ones that are faring the best during this crisis. So I wanted to ask you, Lilliam, I mean, it's like just because, you know, you've been at the helm of so many agencies that have been delivering sort of crucial social services. I mean, from the Department of Employment to being commissioner of the Department of Aging, sort of housing preservation and development. So many agencies that are supplying some of those sources. What are those social support systems that are failing the most right now? Let's say, I mean, it's like that are ailing the most, let's say, and that need overhauling or that need significant changes.
So I think that the problem we have is not just so much the people who depend on social services provided by the city. They're probably receiving it to the best of the ability of the agencies. And I think agencies are working very hard. I think you have the working poor that are really falling through the cracks. I was astounded by the degree of food insecurity, the number of people who have lost their minimum payment job, and that all of a sudden have no money for rent, have no money for food, have inappropriate or no access to real health care. All of these people that somehow, that 50% that lives in poverty, that out of a sudden are deprived of any kind of income. And I think that's the most, the group of people that is the most concerning. I think, that the reality is that social services are geared for people who are really the neediest, if you will, but have never tried to reach to the next layer, who is probably very needy, but not quite eligible for those services. And I think that's what you're seeing now, is that is the group that is probably the most vulnerable. The group that lost your job and has no way of accessing anything else.
Mm-hmm. Yeah, so that's an excellent point that you're making. I mean, it's like social services agencies are already working as hard as possible to deliver the services that they can deliver, although they're aimed at sort of the neediest. And yet there's this whole sort of section in the middle. I mean, it's like people who are lower to moderate income. I mean, it's like people who are sort of middle class. I mean, it's like, but not on stable sort of financial and social ground. I mean, it's like who are also really feeling this crisis because they have few places to turn. And that kind of shows, I mean, it's like where our social safety net is thinner in some places than others. So we've been talking about a lot of doom and gloom. I mean, it's like in this case, although, I mean, it's like, I actually wanted to pick up a bright point that you said, Ruth, that although social isolation, I mean, it's like, as you said, is sort of the killer on the opposite end. I mean, it's like if too much closeness with people is, the main way in which this virus is transmitted. And on the other hand, I mean, as you have social isolation that has been an ongoing pandemic for people of all age groups, but especially older adults that find themselves at the margins of society. Yet we're seeing that there are older adults who are finding the emotional resilience to say, well, I've been through crises before. I mean, it's like I've lived up until now. So, I mean, it's like I can weather this too. So are there any bright points like that you're seeing through this crisis? I mean, it's like any perhaps stories that you've heard of sort of resilience through this, or basically any other bright points, I mean, it's like that we can take solace with, that you've heard of.
Well,
So I'm sorry, go ahead. Go ahead.
We'll take turns. I think that one of the opportunities that is available to those people with the technology capacity to take advantage of it is the amazing cultural access that we all have now for free. The fact that museums have put everything that they have digitally in front of their paywalls, the fact that I can randomly be sort of scrolling through my Twitter feed and watch the original cast of Hamilton sing, the musical to a little girl who couldn't get her tickets and they wanted her to have the experience. I think maybe somebody engineered that a little, but it was an amazing thing. The fact that, and the fact that you've got this again, always outpouring of volunteers and neighbors and, our council members, our other elected officials becoming hubs for activism on behalf of one another. This was what made New York feel so amazing, despite the hardships following both the hurricane and 9/11. And it's harder to get that feeling of community to permeate the walls of our separate dwellings. And of course, harder and ironically missing for those people who have no dwelling walls to be penetrated. But yet those feelings of community, if we can only capture them in a bottle after these disasters happen and build back based on them, then we actually do come back following this. This is leaving aside, of course, the economic, the stronger economic impact that this will has had already than either of those two disasters. But at the same time, it's that community spirit that is what's going to build businesses back also.
Mm-hmm. Right. So, I mean, it's like certainly, I mean, it's like the arts and culture that we've been, I mean, I've certainly been enjoying, you know, having access to that. And then also that community spirit. I mean, it's like where people are aware that there's great interdependency among all of us, and that, you know, there's some community being built even though we're physically apart. Lilliam, are there any sort of stories or things that you want to add in terms of bright points?
Well, you know, very bright, but one of the things that I was been amazed is that I know a number of my friends, and, you know, more than 10 for sure, whose mothers who are in their 80s and 90s are volunteering to make face masks because they can sew that lost art and they can, you know, do things manually, and they are volunteering to create all these things. I was astounded. I mean, and these are very old women who have risen to the occasion and decided that they're not going to spend their days just passively doing very little, but they're going to make a contribution. And I think that that's so heartening, because they want to be part of a community and they will be part of the solution.
Mm-hmm. And that's a great thing to remember as well. I mean, it's like that older adults, I mean, it's like want to connect to society in important ways. I mean, it's like want to remain, I mean, like all of us, I mean, it's like, it's not just older adults, it's everyone. And yes, I mean, it's like to the extent that this provides an opportunity, that's something that we should definitely think about moving forward about. I mean, it's like the way that to the extent to which older adults should be more integrated into society. So speaking of the future, I mean, it's like now that we're already on that topic, can you think of any sort of specific actionable policy recommendations that you have for sort of creating a new, better normal after this crisis wanes and passes? I mean, it's like one of the things that I think about a lot, and I think a lot of us are thinking about, is that waiting for things to get back to normal isn't quite enough, because as we know, I mean, it's like, and as we've, you know, talked a little bit today, normal wasn't good enough for a lot of people. I mean, it's like, especially when you consider inequality and the effect it's had during this pandemic, when you think about, I mean, it's like inequality among races, among ages, et cetera, the normal wasn't good enough for a lot of people. And we hope that the new normal will be better, and that we hope that we learn something from this experience that we've all collectively gone through. So what are some policy recommendations that you have that you hope will be part of that new better normal?
So if you want me to go first, I think one of the things that to me makes a lot of sense is to provide a minimum basic income for everybody. Because it is impossible to think that we're going to have crisis like this and so many millions of people are going to be without any kind of an income. You know, welfare as we knew it or know it, it's not enough. I think we have to think in terms of providing a minimum basic income. I think that that's one of the most important things that we need to start discussing.
And obviously, with minimum basic income is universal health coverage that is unrelated to employment. You know, if we, at the 1.2 million New Yorkers who've lost their jobs already in the last 6 weeks are also people who have lost their health insurance. There's, as we know, another million New Yorkers who are in the sort of gig and under the table and, you know, part-way economies that don't provide health insurance. And while health insurance doesn't keep you healthy, it does keep you from being bankrupt after you've had to have a lot of health care. And if ever we have seen that housing for all can't just be a slogan, if we can countenance a world where new viruses sweep across populations, requiring social distancing to retain health, but yet have people with no homes in which to socially distance, then I think we really have really lost our humanity. To bring the sort of aperture way down, I think this is also an opportunity to rethink what are senior services and to rethink them more specifically, differentiating what are social services and meeting minimum basic needs, which need to be provided to people regardless of age, in an integrated system where we're not building separate systems for separate age groups, because that's not incredibly effective or efficient. And then to think about what are the things that people need based on age, which have everything to do with further training and access and familiarity with technology, information and portals to the fullness of the city overall, and access to our great institutions and universities for people of all ages. And I think once we get those functions teased apart and we have universal income support and food and housing, we can separate that from what we need to address the issues around stimulation and isolation and joy.
Well, more joy. That sounds like a wonderful world and a wonderful thing to look forward to. Okay, so Ruth and Lilliam, thank you so very much. So I'd like to. We have 10 minutes left in our program, so I'd like to pick up on some of the questions that you left in the chat. So I actually want to start with Joan Fabio. Actually, it's like full disclosure is one of the chairs, along with Lilliam, of the President's Advisory Council for the Brookdale Center. And so she's asking that there's been a lot of discussion around testing as one of the prerequisites for opening up the economy and lifting the lockdown. It's like that testing, it's like being able to test a lot of people is an important part of being able to do that. But what does that mean specifically for older adults who have been and continue to be sheltering at home?
I'm sorry, Kristen, I was reading the chat. I wasn't listening.
Oh.
So let me take a stab. I think that is, it's a really interesting question, because if people have been staying at home, avoiding all kinds of contact with other people, the assumption has to be that you probably would be negative for COVID. The reality is that we don't know, because we don't know how this virus really acts. And so I think that universal testing is something that has to be a goal. If we're all going to feel comfortable going out of our apartments eventually, because it's very frightening to think that, we've been all sheltering in place and everything is fine. And then they declare the moment where we're all going to go out and bingo, we're all going to get sick after that.
Mm-hmm. Yeah, so Ruth, so the question was basically, what would you say to older adults who have been sheltering in place? It's like, especially given all the discussions around testing being one of the most important things that needs to happen before the economy is opened up.
Well, I think one of the things that we'll be paying more attention to in the coming weeks is the fact that access to health services is almost entirely restricted to those people with symptoms of COVID. Over the next coming weeks, that's going to start to be more of an issue. You can defer your ongoing health care for chronic conditions for a period of time without ill effects, but not for an infinite period of time. So people are going to be needing to be making their way out to in search of healthcare. That testing would be included into that healthcare that people are seeking anyway is important. This is separate from the testing that is necessary of a random sample of the population that is necessary for us to be able to track where the epidemic is in the community and when it's safe to open, not open. We need to be absolutely clear that there's no kind of situational testing that is going to give us the information that we need to know about what is the actual underlying distribution of the virus and what is it safe to do and not do. So that doesn't have to do with testing older adults or any other specific population. That has to do with a different thing, which is testing a random sample of the population, a thing that we haven't even approached.
Got it. Got it. Okay. So there's another question coming in, sort of that picks up on our former discussion about social isolation and loneliness, and how this is something that different age groups experience differently. So the question is, how can this experience of this pandemic help us break down the age-segregated society we live in, and how can we build intergenerational connectivity?
Nice.
It's a very challenging question. I think that we live in a very unintegrated society, not only by age, but by sometimes by gender for sure, but by race, by ethnicity. We all live in little enclaves. So I think it is a challenge, but I do think that connectivity through all kinds of media can be very helpful. And I think that that's part of probably what has to happen. If one of the lessons I think from this is that, many more people can work from home, that we can use certainly the internet in many different ways we had not explored. I too have enjoyed tremendously watching, theater through the internet, much cheaper, by the way, and very enjoyable. So I think we have to begin to experiment in terms of how do we use technology to make life more integrated, but also more accessible for everybody.
And I think it makes possible participation in a wider range of institutions. So there's sort of two ways to look at the fact that we're living by Zoom. One way is it's a drag, and it's kind of, I wish I could, give you a hug. And the other way is that, at people's seders, they had family members from all over the world who couldn't usually participate. And so it makes me think about maybe in a weird way, this jumpstarts the age-friendly university in a way that gathering together in one classroom was sort of a barrier, but we can gather together in one Zoom field or whatever the hell it is more readily. And similarly, be in an art class that is where it's just everybody who wants to participate in this medium, regardless of age. Does it maybe break down some age barriers that we're doing more things remotely rather than build them up? I'm not sure.
Yeah, so there's certainly a lot of open questions there. Going back to the testing discussion, one of the questions is really around undocumented New Yorkers, especially because, there's a big question there about, especially given the current environment, how are we going to ensure, what is it going to take to make sure that people who are undocumented are coming forward for testing and coming forward for treatment, if it comes to that?
It's ultimately an issue of trust. I mean, I think that people are very, very afraid that if they come forward, ICE would be notified. And I think that that's going to be a barrier as long as we live in an environment that is not user-friendly for people who are not documented. I think, and that's a real public health issue in a pandemic. The people who are afraid to come forth when they're ill, because they'll continue to spread the disease, even unknowingly, but sometimes because they can't avoid going out. So I think it's something to really seriously think about, because it's going to make a very vulnerable situation for us all if they are not coming forward.
And that, of course, is one of the origins of public health. One of the origins of the idea that populations are interconnected in our health, and that, it's now sort of I guess you don't have cliches anymore, now you have memes. But anyway, it's a sort of a cliche that, our health is only as good as the weakest among us. I think the first thing that it has to be possible for people who are undocumented to come forward for is receipt of income support, receipt of, people who are undocumented are excluded from the federal stimulus for the federal income support. Even households that have any members who are not documented are ineligible for this. And I feel that we have to create a bridge where we recognize again that we're all in one big pot of soup together before we can hope to imagine that people will trust us.
Okay, so I'm gonna leave space for one more question. I know it's 4 o'clock, but just one more question, to finish us off. And so this is sort of adding to the list of recommendations. How about compassionate release for some prisoners? It's like who find themselves in these situations where it's hard for them to social distance as well.
Absolutely. But here's the thing. Where are people going? I support release fully. I support release of all these people who are in there on these technical parole violations. Absolutely ridiculous, always been ridiculous. Support compassionate release of people across an age spectrum. Support far diminution of incarceration in the first place. But here's the issue, and we know this from years of work. There's not so many facilities and supported environments willing to take people who are being released, particularly from longer term incarcerations. And releasing people to nowhere is not that helpful to them.
Well, yes, and I think we've been releasing people, and many of them end up in shelter. And right now, shelters are the worst place for people to be at, because they're congregate situations in which the contagion is there for sure. So it's very problematic. I agree with you. It's release is only compassionate if it has some planning going with it.
Mm-hmm. Okay. All right, everyone. So thank you very, very much for joining us. It's like, I hope that, it's like one of the main things that you're able to see from this discussion is that when you're talking about the impact of COVID on populations, it really is a very different story depending on, it's like which populations you're talking about along the lines of age, of class, lots of different divisions that, frankly, it's like are the underpinning of the social inequalities that we see in society itself. So it's like it's true. It's like that it's one of those cliches that our public health system is only as strong as the weakest among us, etc. But I think the same thing can be extrapolated to all of society as well. I mean, it's like a society is only as strong as the safety net that it creates to catch everyone. And this crisis has really highlighted that in a devastating way, but at the same time, for those of us who are studying this, who are trying to find solutions, sometimes it's important to see. I mean, it's like this is what's really important, highlighting what's really important here. And this pandemic is certainly doing that for us. So thank you so much for joining us. Thank you for your questions. Thank you especially to Ruth and Lilliam. I mean, it's like for your brilliant insights around this. Thank you, President Rob, and thank you, Roosevelt House, for organizing us and bringing us together, even though we're not physically in the same room. So thank you.
Thank you.
Have a great afternoon.